really dive into this idea of the incidence of re-injury after ACL reconstruction, because this concept is really not a new one. It was first discussed in the literature as far back as in 1988. So in 1988, Sorrell et al. Published a study in AJSM, and what they talked about, these authors talked about this incidence of bilaterality. And essentially what they reported as the incidence of bilaterality was really the number of patients that came into their clinic with an ACL injury, but this was actually on the contralateral limb to a prior ACL injury. So just at that, as far back as 1988, we were starting to recognize that that number may be as high as 4% of the patients that were reported in this study. So probably 1 out of 25 patients that came in had they were looking at a bilateral ACL injury. Fast forward to 1996, so Don Shelbourne published a study in AJSM in 96, and actually had nothing to do with re-injury. But he did report on a large cohort of patients after ACL reconstruction. And if you dive into his data a little bit, what you quickly realize is that 1 in 26 went on to tear their contralateral ACL, and 1 in 37.5 went on to re-tear their ACL. So again, the numbers start to be a bit concerning, because these are actually much higher than primary ACL incidence rates, which are reported in the literature, which are generally in a high-risk population, anywhere between 1 in 80 to maybe 150, you may see a report in the literature, and that's in high-risk populations like female athletes. So now we're starting to see 1 in 26 and 1 in 37, where that number is a lot more concerning than we once thought. So now we'll fast forward to 2007, and Rick Wright published a study in AJSM that was data from the MOON Group. So the MOON Group, as many of you know, is the Multi-Center Orthopedic Outcome Network. So it's a pool of data that comes from several orthopedic surgery groups across the country. They pool their data and report out after ACL reconstruction. And what they reported in 2007 was that 6% of patients that were included in this group suffered a second ACL injury. Half of those were contralateral ACL injuries, and half of those were ipsilateral, which at first glance actually is pretty good. We're thinking 6% gets re-injured. That's not too bad following ACL injury. But it's important to really dive into the data and think about who those patients were. So first of all, they were a younger group. They were not a younger group. They were a really heterogeneous group. The patients which were included in that were anywhere between 18 and really, I think, 70 years old. So a really wide range of age, and we'll talk about why age is really important over the next few minutes. But in addition to that, it was a relatively small cohort. So now we'll continue in 2007 and look at Leo Pinczewski's work. So this group actually is a report out of Australia, and it was a very large cohort, over 700 patients who were included in this study, and it had 10-year follow-up on those folks. And they reported at their 10-year follow-up, 27% had suffered a second ACL injury. So now we're starting to see data that actually is concerning. To think about a 10-year follow-up, 27% would suffer a second ACL injury. So these next two studies in 2011 and 2015 are the identical cohort. So the same group that was reported in 2007. Now at a 15-year outcome we see is a 31% second injury rate, and at a 20-year outcome we see is a 36%. So over a third of patients in the 20 years after they have ACL reconstruction, this cohort suffered a second ACL injury. So again, rather concerning data that we see. So continuing on, now we see a nice systematic review that was done by Rick Wright again, so Rick Wright out of St. Louis, and he looked at, he did a systematic review of studies that had 5-year outcomes after ACL reconstruction, and what he noted was that the second ACL injury rate was about 18%. 6%, 5.8% suffered an ipsilateral injury, and 11.8% suffered a contralateral injury. So now again, looking at longer outcomes and with more homogeneous groups, we're seeing that those data are a bit higher as well. So now we're going to look at several studies, and we're going to look from an epidemiological perspective of what we report as crude incidence. So crude incidence is basically just a percentage of folks that suffered an injury over a defined period of time. So this, you'll see reference Rick Wright study in the MOON Group data, which is 6% at 2-year outcome. The 2011 systematic review suggested 17.2% at 5 years, and then Pinczewski's first data was suggested 27% at 10, which we know went up to 36% at 20-year outcome. So we did an outcome study, which we've been doing over the last 14 years in Cincinnati Children's, and we looked at second injury risk in what we thought was a very high-risk population. So we wanted to look at folks who we thought were at highest risk for second ACL injury, and those were young athletes who were going back to pivoting and cutting sports. So for our data, we included folks who were between 8 and 25 years old, and all of which had stated their intent to return to pivoting and cutting sports. And we enrolled those patients at the time that they had been medically released to return to sport. So they had seen different orthopedic surgeons, PTs in our area, and then they were enrolled in our study at that time. And we assessed them once they were medically cleared to go back to sport. And then we tracked them over and actually we've tracked some up to 10 years now. And what we noted was that in the first year, there was a 23.6% second injury rate, which included both ipsilateral and contralateral limbs. And then at 2 years, it was close to 30%. So again, our data seemed to be much higher than was previously reported in the literature. So before you all think that we just don't know what we're doing in Cincinnati and our surgeons stink and our rehab is horrible, it's important to consider why our group is a little different. And our group was different because it was that high-risk population, young athletes going back to pivoting cutting sports. Whereas these other studies have looked at much more heterogeneous populations. So again, not necessarily the younger athlete and not necessarily returning to pivoting cutting sports. So when we look at those high-risk groups, we know that we see a high second ACL injury rate. So just some more data from these studies. So in addition to looking at percentages, one thing we did with our data was we tried to normalize it to athletic exposures. So we were trying to see if we looked at a normalization over how active folks were after they returned, what were the relative risks between those groups. And so what we looked at was patients after ACL reconstruction, and we looked at those who went on to suffer a second ACL injury. And then we compared that to a control group of individuals who had never suffered an ACL injury. And what we noted was that, and we looked at both males and females, the group that had suffered an ACL injury, they were 15 times more likely to suffer a second ACL injury than when we compared it to a healthy group who had never suffered an injury. So again, much, much higher than we thought. When we looked at just females, they were about 16 times more likely to suffer that second ACL injury. So we know prior history of ACL injury is certainly a risk factor for future ACL injury. That was just in 1 year. When we fast forward and we add 12 months to our tracking in that same cohort, what we noted was that in the first 24 months, that group that had suffered ACL injury, when we compared to those who were healthy, they were still about 6 times more likely to suffer a second ACL injury. And then our females, again, were about 5 times more likely. So you notice in the first 12 months, there was a much higher risk, 15 to 16 times more likely. But when we look at the first 24 months, they're about 4 to 6 times more likely. So we'll talk about that as well. And that's really reflected in this Kaplan-Meier survival curve. So we've seen a few of these posted today. But again, the idea of this graphic is to compare when these injuries were occurring, not necessarily over time, which a lot of Kaplan-Meier survival curves look at, but over daily exposure. So how frequently these athletes were active after their ACL reconstruction, they returned to sport. So the blue line represents patients after ACL reconstruction, and the green line represents our healthy controls. And again, what we see on the x-axis is daily exposure. And so interestingly, you can appreciate by how quickly the blue line descends that early after they returned to sport, we saw a lot of second ACL injuries. So much so that over 30% of those who suffered a second ACL injury had that second ACL injury in less than 20 athletic exposures. So our athletic exposures included any practice or game that they participated in after they returned to sport. So you can imagine the majority of these folks are high school athletes. And their average age is around 15 to 17 years old. So essentially, if you're going back to your pivoting and cutting sport, those 30% of those athletes probably suffered their second ACL injury within a month or two after they returned to sport. And over 50%, 52% to be precise, suffered that second ACL injury in less than 72 athletic exposures. So probably less than 5 to 6 months after they return to sport, they're suffering that second ACL injury. So again, thinking back to those 2 studies, the 1 year and 2 year outcomes, is likely why we're seeing such a higher relative risk in the first 12 months compared to the first 24 months. So that period of early return to sport is definitely a high risk time in these young athletes. So more data, Phelan et al. Did a nice review article which looked at comparing ipsilateral and contralateral injuries, and you can again appreciate that it appears that actually the contralateral injury, when we pull some of these data from these 4 studies, appears to be at higher risk actually than the ipsilateral leg as well. So again, things to consider as athletes are going back to sport that may be, depending on the athlete, we may be seeing more contralateral injuries than actually ipsilateral graft failures. So if we kind of summarize this idea of this incidence of second ACL injury, we know that the recent data suggests that our rates of second ACL injury are much higher than previously reported. If we continue to have the mindset that only 3 to 6% of folks will suffer a second ACL injury, that's a big blind spot for us. We have to appreciate that there's specific high-risk populations that when they go back to pivoting and cutting sports are at high risk for second ACL injury. The greatest risk of that second ACL injury really appeared to be in the first 12 months after returning to sport. So again, thinking about when these athletes are going back, are they really ready to go back? And those